Hi there, my name is Yossi, here to discuss a few things with you about genetics and the IVF laboratory. So when we talk about the genetics that we look at in IVF, we look at two different aspects. We have patients who come to us who have infertility problems. These are patients who are struggling to conceive, or they are patients who are having recurrent miscarriages. Patients who've had multiple IVFs done and they've been unsuccessful. And what we do for these patients when we do IVF is we can do genetic testing of their embryos, which we call pre-implantation genetic testing for aneuploidies. All the cells in our bodies have 46 chromosomes, except for eggs and sperm. An egg has 23 chromosomes and a sperm has 23 chromosomes. They come together, they form a unique organism, a unique cell with 46 chromosomes. What we are testing with pre-implantation genetic testing for aneuploidies is that all of the cells in an embryo have 46 chromosomes. We want to make sure that the cells are not missing some chromosomes, maybe have an additional chromosome, missing part of a chromosome, or have an additional chromosome added to part of their other chromosomes. You may know about Down syndrome, a condition where a child is affected with 3 copies of chromosome 21 or trisomy 21. You may know of Turner syndrome, and these are girls that are born with only 1 X chromosome instead of 2. And these are the abnormalities that we look for in conventional pre-implantation genetic testing for aneuploidies. And we do this specifically to improve IVF outcomes, to reduce the risk of miscarriages, and where we have couples who've had multiple embryos transferred in their uteruses and they're not becoming pregnant, and we want to see, are we putting embryos that are chromosomally normal into their uteruses or not? Because if not, then we know we have to look at potentially changing the eggs or changing the sperm. But if we are putting genetically normal embryos, chromosomally normal embryos in a uterus and they're not becoming pregnant, we need to look for other causes of why potentially they're not falling pregnant.